Now, next on the list, we have some very amazing speakers. I think in my dictionary book, it's always either amazing or fab or great, so very limited recap. But they are really, truly incredible in terms of the research that they're doing that is benefiting Victorians living with diabetes. So it's a new initiative that Glenn was talking about earlier on, the Victorian Virtual Emergency Department Diabetes Service. This service provides Victorian with free urgent telehealth care delivered by diabetes specialists. And so to delve a little bit deeper into this program, we will have a panel discussion now. So to moderate the panel and facilitate that, we'll welcome back Glenn. So Glenn will come and introduce the panel as well, and we'll hear a little bit more about this Victorian Virtual ED and where it's come about, how it's going, and where it's heading to. Thank you.
Thanks, Daniel. I said before, it's a really exciting initiative. New initiatives like this, they take a lot of work. They take a lot of inspiration. They take a lot of perspiration to get up and running. And I say that in particular, in the current economic times, in terms of getting additional funding to actually bring new services to fruition is no small task. So that's what we're going to talk about. From my perspective, it's been an absolute privilege with Diabetes Victoria to play a small role in the work to get this service up and running, and to collaborate with absolutely amazing organisations, in particular Arcadi, represented by Elif, Northern Health, Lauren, Ambulance Victoria, Royal Flying Doctors, and the Victorian state government to launch this service. So all amazing organisations that have done amazing work to get this up and running. So with those words of introduction, let me introduce the panellists. So we have Professor Elif Akinci. Elif is the head of the Department of Medicine at Melbourne University and the director at Arcadi, which is the Australian Centre for Accelerating Diabetes Innovation. Thank you, Elif. Yep. Dr. Lauren Scher from the Northern Hospital and the Clinical Director of the Victorian Virtual Emergency Department, and Dr. Ben Nash, Endocrinologist and Diabetes Lead of the Victorian Virtual Emergency Department. Welcome, Ben. I'm not underestimating this when I say these three people have been the absolute drivers behind this service from the get-go, from the start to where we are today. They've done amazing work. They've led this with fantastic intent and fantastic collaboration. So let me get to a few questions, and I'll start with you, Ben. So for many people in the room that won't have heard of the service, and probably until this morning, can you provide a bit of an overview of what the service is about, how it specifically caters to the needs of people living with diabetes? Thank you, Ben.
Sure thing. I think that's on. Excellent. Just first of all, I just really, from the bottom of my heart, want to congratulate everyone, family, as well as people living with diabetes who are here for 50, 60, 75. It's an absolute huge event. I've had diabetes for near 20 years. When I got asked to come and talk today, I had to text my dad because it turns out he's at 49, so I'll be in the crowd with the family and a friend next year. But really appreciate the opportunity to come and have a chat about this new service. It's certainly something that's been in the works for over a couple of years now, and it's very much been a team effort and something that's founded on a lot of lived experience, a lot of organisations coming together, and something that we're all really proud of. Essentially, the overarching aim is just to improve access to urgent diabetes care, regardless of where you live in Victoria. So just think of it as if it's something you would otherwise have thought of going to an emergency department, or something that could escalate to need to be going to an emergency department, you could get in touch with us. And what us is, I've got some slides. Here's something I prepared earlier. So I might be able to just take you through. the clicker works. Okay. So we'll come back to this slide at the end, but essentially what we have is a 24/7 service, a free service that's accessible to all Victorians, and it's a virtual emergency department with specific catering specifically for people with diabetes, as well as more broadly all Victorians with all non-life-threatening emergencies. So I think it's best just to take you through how you might approach the service in terms of getting an understanding of what it is. So Lauren to my left has been an absolute innovator in this space. During the period of COVID, we had a virtual emergency department built, and Lauren's leading that, and it's been seeing over 400,000 Victorians since its inception. Subsequently, we've, over the last 3 months, joined Lauren and this established service with a diabetes-specific pathway, and that includes having diabetes specialists available to see people in the community, so diabetes nurse practitioners, endocrinologists, and this is in addition to what Lauren already has in terms of emergency physicians, general practitioners, paediatricians, paediatric emergency physicians, a whole range of healthcare professionals available 24/7. So it's something that we're just coming to the party in the last few months, but something that we've been working on for quite some time with multiple people across the state. So essentially there's two main pathways to access this service. It's either the person with diabetes or their carer, family member, or the alternative pathway is a healthcare professional. So that could be a paramedic that's with you at a time of an emergency, your general practitioner, a residential aged care facility. All roads lead to a telemedicine interaction with a diabetes specialist, and this is really exciting to have this level of accessibility of diabetes specialists through emergency situations, because you guys know you've been living with diabetes for so long. You're doing most of the management, 99.99% of the time, it's you guys at the coalface doing all the management, but sometimes you need some reassurance, some assistance with 6-day management, and that's what we're here for. We're here for those non-immediately life-threatening emergencies where things like hypoglycemia has been quite severe, you've needed assistance, your ketones are elevated in the setting of having gastro illness, those sorts of things. We're here to help you, and it's a free service 24/7. We've got interpreters 24/7. We really want to help people access it from all corners of Victoria, and essentially this is what you'll see. So if you go to bbed.org.au, you'll get greeted with 4 blue tiles. You pick the one that's most relevant to you, so person with diabetes or carer, and then you'll be greeted by an emergency triage nurse, and if you're triaged with a primary diabetes problem, then you'll be seen by a diabetes specialist nurse practitioner. This is us, this is the team, this is a small portion of the team. So we've got 6 really excellent nurse practitioners with decades of experience and a lot of complementary skills. We've got Lauren and Alif who are here with me today, and then we've got just everyone else who's been involved in building this over the last couple of years. So hopefully that gives you a bit of a snapshot as to what we're doing and what we're here to talk about today.
Thanks, Ben. That's great. That's a great overview of the service, and I think gives a sense of the significance of it. I'll come to you, Elise. Cast your mind back a little while. Where did the idea come from? Where did it germinate from, and what brought it about, and what was the need in the community that you were looking to address?
Yeah, look, I'm a clinician scientist, so an endocrinologist. I've had years of experience looking after people, obviously in the when they're at this, the point of really needing care, and in the hospital, in the emergency department, and when people are admitted. And one of the things that we as clinicians recognise is that if we could have somehow helped that person earlier, that they wouldn't have deteriorated. And sometimes, especially during COVID, we had some very sick people who either it was their first time being diagnosed with diabetes, but they were just really unwell and they were in intensive care. And so some of those things that could have been done earlier to help to get the care that they needed
I've always felt that we could do more for people. And we actually in the past tried, like we have nurse practitioners at the Ulster, like Simone Patterson, and we tried to sort of organise something that was an on-call service, phone service, but it was just never sufficient. But one of my patients actually used the Victoria Virtual ED just around the time of COVID, and then she told me about it, and that's when as soon as I found out, I was like, oh, this could be really good for our patients. And so that's when I managed to contact Lauren, and then we started this collaboration. And you know, it was, and Lauren was fabulous. She was very open and understood the need. And as you know, we had situations in our hospital, and I'm sure in other hospitals where the persons with type 1 diabetes has run out of script, and they've just come to get that, and then because it's a long weekend or whatever, they've just deteriorated whilst they're waiting. And just so simple things like that could be prevented, or just not knowing that they've got diabetes in the first place. So, and then it was around the time when, Ben was my registrar, and he was in Tasmania, and I said, look, Ben, this is a great project. You better come and, help us get this off the ground. And he came across, and he's started helping us. And I think really comes from recognising there's a need, and it also comes from wanting to reach out to people at their time of need. And the best part, I think, of one of the best things about this is that finally we have ketone testing in ambulances, and I understand people have tried to do that in the past, but it hasn't been possible because when you have an intermediate result, it's not clear what to do about it. And now the virtual ED, we set up the guidelines so people can ring up. And then I suppose the other bit that is relevant is that the centre I lead, which is called ACADI, Australian Centre for Accelerating Diabetes Innovations, has came out. It's a National Diabetes Research Centre, but one of the arms that it looks at is the prevention of these acute complications. It's been recognised from an independent analysis that those acute complications that bring people in and out of hospital, they're really important focus of the centre, and it also comes out of wanting to address that need. So sort of a bit of a summary.
Yeah, well, thank you. Thanks. It's taken a couple of years, and you've done such amazing work to get it up and running. So thanks so much. So Lauren and Ben, I'll put this one to the two of you. So it's been launched a couple of months ago, or July, so not that long ago. The feedback that you've been hearing thus far from the community, just maybe a sense of that, and what some of those sort of stories are that you're hearing in terms of how it's had impact in terms of improving health outcomes.
Well, I'll get then to discuss the community. I think what I want to highlight is the feedback from some of the clinicians working in the virtual ED. And what's been really amazing to see is that the doctors working in the virtual ED are so appreciative to have the nurse practitioners working alongside them, and they recognize that their amazing knowledge and skill set can bring such an additional level of care to the patients. And I think that for me has been really rewarding and wonderful. And we're now at the point where they're asking for more and more. So I want more nurse practitioners, and then they really want the service to be as robust and as available as possible, because they can see the benefits for the patients. So it's not just about the way we've developed the service. It's not just about dealing with the immediate problem. It's about recognizing the opportunity to really optimize those patients that they're entering the service and really provide wraparound care. And that is always very rewarding for us in healthcare. And I think we really appreciate that as clinicians, but now that we have that extra expertise, we can develop that excellent service we really want to deliver. I'll let Ben talk to the community.
I'll be short and quick. People bloody love it. So I'm in a really lucky position to be seeing people in a rapid access clinic. So about a week or so after they've come through the virtual ED, I'll catch up with them to make sure things are okay and we optimise care as best we can. And the amount of praise, I've never come across anything like it in the public system before. It's just everyone is saying how appreciative they are of the nurse practitioners being there when in a time where they needed it most, and also quickly and with appropriate follow-up and safety netting. And it's to be able to do that in the comfort of your home, and also reducing the resultant emergency presentation it's been really, I feel like I've got the best job in the world. I just get to get all this amazing feedback about the work that other people have done, and I just say, yes, thank you. we're very grateful. But it's incredible what the team are doing, and it's hopefully no one in the room needs the service, but obviously we're here if you need.
Thanks, Ben. And I think that point around, so the service is the nurse practitioners, but then the rapid access clinic is really sort of an escalation aspect of it as well, which is part of Ben's week of activities is to staff that as well. So I think everyone would be feeling pretty good to come to Ben as the local endo to get that extra help. So thanks, Ben. All right, so just turning to one of the intentions and goals of the service was really to relieve pressure from the hospital system as well. I think we're all probably experienced, turning up to emergency departments, long wait times and the like. So to be able to avoid that and have the service essentially provide that emergency is fantastic. That was one of the original intents. So just sort of perhaps a leave comment on how that's playing out, what you're seeing there in terms of that eventuating.
Yeah, look, I think, when you think about it now, you think, oh, that's very, it's such a simple thing. Why didn't we do this earlier? Just shows you how long it takes to get this off the ground. And, obviously, we had to get all the partners on board. But I suppose getting, people like the flying doctors engaged now, because it's actually people in rural and remote parts of Victoria. And ideally, we want to extend the service to Australia. But we have had feedback that people, in dire straits sometimes, and not because type 1 diabetes is a complex condition to manage, and things can deteriorate during being unwell and so forth. And even, people have had either undiagnosed type 2 diabetes, they're really high glucose levels, or if they're on medications like the SGLT2 inhibitors that increase their ketone levels and make them very unwell, things can deteriorate. And so I think this is where it's like an outreach of the hospital in a way, isn't it? It's sort of how you mentioned that before, and I really like that idea that we've got the technology, why can't we get it into action so we can actually prevent ICU admissions? And really, that's one of the things that we're looking at in terms of the research aspect of it, within the capability of Bacardi and all the other partners, is looking at exactly that, like in terms of the benefits in terms of person quality of life, but also hospitalisation, duration of hospital admission, readmissions, and all the other terrible complications that can happen. How do we ensure that the service continues to address that in real time? That's part of the grant funding that we received from NHMRC on this service, and some of the other grants that we're applying for is to really get that data that we need as clinicians.
Thanks, Liv. Lauren, would you like to comment on that in terms of the hospitals and the emergency departments?
Well, I think, as you mentioned, the project started off as a diversion project. I'm really trying to keep emergencies for, at that time of COVID, we only wanted to see, emergencies and any patients that we could safely manage at home. That was the initial goal. I think while the project continues to be all about diversion, so we want to keep patients out of the emergency department if we can, it really is now all about access to care, recognizing the fact that, particularly in the case of diabetes, it's a 24/7 condition, and unfortunately, you can't choose for your illness to suddenly only occur between 8 and 5, Monday to Friday. And so, really, what we've recognized is that this is an opportunity to address health issues 24/7, 7 days a week, because that's what you live with. And I think in recognition of that, what we realize is this has become more than just diversion. This has become about access to care. And I think and beyond just access to care for illness, it's access to care in the regions. It's, some of the biggest impacts we're having is in the First Nations community, for example, who really trust the service. They find it very culturally safe to receive care through telehealth with their family on country. So we're recognizing that the opportunities for virtual care to really bridge the gap and solve some of the biggest health issues that we've been facing for the last decades is suddenly the technology, the expertise is all available, and we're bringing it all together, and patients love it.
Thank you. That's wonderful. I think that access to care, particularly in regional and rural areas, is so important to appreciate. Final question to all of you. I'll start with you, Elise. I know you're always thinking forward and you're always thinking of what's next. So that is the question. Looking forward, plans to expand the features of the service, or other forms of virtual care or monitoring. Your thoughts?
Yeah, look, I think we would love for this to be a national-wide service, because I've worked in rural, remote communities, Indigenous communities previously, and I know how unwell people can deteriorate, and to get people to tertiary centres is a big deal. You have to retrieve them and find doctors or whichever service or ambulances they can. And so really, I think ideally, if we can get this service to parts of central Australia or parts of rural, remote parts of Australia, I think we can really make a big difference to save lives. I mean, people die from complications of diabetes, right? And it happens where you see it, and it probably doesn't get as much of the attention that it should. But people die, as you know, when they eat heart-rate and things like that. So I think there's a lot we can do to extend the service across our country, ideally internationally as well. I mean, if we can help our neighbours, as you know, many people in our Pacific region really develop severe complications from diabetes and can deteriorate. And so ideally, that's sort of a wish in the longer term, but we could do so much in Australia, which is geographically over apart, and help people.
Lauren, what's next?
Taking over the world. But I think, for myself as an emergency physician, obviously, there's been so much success with the diabetes project. We're looking at where else to next, and we're sort of now looking at, what can we do with cardiac patients? What can we do with respiratory patients? And recognizing the fact that in some cases, there's patients that have all of those things. But I think in the diabetic space specifically, Leaf and Ben and I, we've talked about wound care. All of a sudden, these opportunities for patients who live really remotely to have their wounds assessed more regularly, use experts that are centrally located to help manage those wounds locally. Again, avoiding unnecessary trips backwards and forwards. All these opportunities are presenting themselves, and I see that virtual care will enter that space.
Thanks, Lauren. Ben?
I think if we go back to the overarching principle of improving access to diabetes specialist care for people who need it when they're most vulnerable, all locations, I think we are really going to be guided by how we're doing when it comes to that, and that'll help us focus our attention on where we need to. So, if we're not doing those things right, when we reflect on how we've been going over the first few months, then we need to continue to orient and be agile. And that's the beauty of this. This is first time this has been done anywhere in Australia, if not the world, this sort of model of care. So we've got the capacity to build the culture from the ground floor and constantly iterate and be agile. And that's the really exciting part of being involved in this project. So slightly more boring, but that's my answer, and I'm sticking to it.
First of its kind in Australia. In and itself is just an amazing thing. Thank you, everyone. As I said, this has come about through a tremendous amount of work. The three of you have been at the forefront of it. Thank you, I think, on behalf of the entire diabetes community for everything that you've done to get the service to this point. So please join me in thanking the panel. I do encourage you to visit the site, as Ben said, BVED website, and check out the features. Save the URL for quick access on your mobile. When you do need it, you've got it. And there's a QR code also on the table. So once again, thank you very much, everyone.